I'm George Omolo-Kothe. I'm the current chairman of this facility.
My name is Maureen Achieng Owino, and I'm a nurse stationed at this facility, and I've been here for the past 3.5 years. There's a church around 1 kilometer from here. It started, yes, there is where the facility started, underneath a tree in 2009. Then the facility moved from the tree to another building there in church. Then from church, it went to that other building you're seeing out there. Yeah. So that's where it has been for a very long time, until 2015.
The county government managed to build for us maternity wing. That is the building you are seeing there, with all those rooms.
Now you see, this unit we are in should be purely maternity. But because that other structure is small, we decided to encroach this side. Have room 1 as outpatient, have room 2 as antenatal clinic, have room 3 as the delivery room, and then the room 4 is where the woman can now rest follow after delivery. We offer curative services, we offer preventive services. Talking of preventive, we're able to do immunizations when it comes to under 5s. We're able to do screening, that is HIV screening, cervical cancer screening. We're able to screen even other illnesses. When it comes to curative services, in this case, the illnesses we are able to manage here in the facility. Most common ones are malaria is on the top of the list. Yes, we also have diarrheal diseases in children. Respiratory tract infections. Yes, those are the common illnesses that we manage here. Skin infections. And reproductive services we also offer, which involves conducting deliveries. We do conduct deliveries. We also offer family planning services. But there are other illnesses which we are not able to manage. And in those cases, those kinds of illnesses we do refer for further management, either in a health center or even county referral hospital. So I feel infrastructure-wise, we are still way behind. And I feel more needs to be done. And on top of that, if we can have like a staff house.
Tukipata building kidogo hapa ya nurse mwenye anaweza kukaa hapa hata usiku. Hata kuwa kama mtu mama ya iko na mimba anaweza kuzaa, wamama anazaa usiku. Anaweza kupata sister hapa na apate usaidizi.
We get calls even during the night by community health workers that there's a woman who really wants to deliver. But since we stay far away, we are not able to help these women during the night. So they are transferred to nearest hospital, that is Tingwangi or Sia County Referral.
If you come here on Mondays, this place is congested with different types of activities.
We work with what we have. At the moment we have a very big problem. We have stock out of many drugs. Like we have to wait until they are delivered to us. So at the moment, you know, it's the patients who are suffering. They end up buying drugs or buying commodities which are to be used. There are times we don't even have gloves. So a patient has to come in with gloves. You know, it's a challenge. So I feel being free is a good thing. At the same time, it isn't a good thing. Yeah. And besides that, we also get some fees, user fee or Danida funds, which come in sporadically. You can receive it even after 2 quarters. Okay, so that's the money we use to run facilities. We buy the basics, the detergent for cleaning the facility, our stationery. Yeah, so that's where we get our source of money. And all this comes from the national government. The moment they don't deliver it on time, we have challenges operating the facility. There are quite a number of things we didn't have.
Our first lady, Mrs. Salome Atandi, thought it wise that he should bring some of his friends So the room was not all that good. So he facilitated funds, and she made sure that we renovated the whole room by putting tiles, painting the same.
Like blood pressure machine, HB machine. So with this machine, the HB machine, we'll be able to monitor these mothers. Those whose HBs are low, we are able to work on that before they get to delivery, which is of great help. With Mrs. Atandi, we also received the BP machine. We are able to monitor the mother's blood pressure machine, and quite a number of things that we also received from her have been very beneficial to this community. We didn't have an ultrasound machine. We didn't have a microscope. Drums for sterilization, we didn't have those. We also had a few delivery packs, of which we had 2 through Mrs. Atandi. Beds, before that we had only 3 beds, but we had 10 more. Now we are talking of 13 beds, which is quite a big improvement in this facility.
The last message that I can say, first, I'm very much thankful as the chairperson of this facility on behalf of the community. And we really praise the good work she had done.
So donors are of really great help, especially with what Mrs. Atandi stood for. We've been able to run our maternity and even our antenatal clinic so well.
Mimi narudishia MP yetu asante, na mama Salome asante kubwa. So naona kama hapo ni clean tena mzuri. Asante kabisa. Hata ikiwa mnaonanga mnaweza kukutana naye, umwambie wenye Malanga tumerudishia asante kubwa. Aendelee tu hivyo.